Hello, friends. Welcome to Find Hope, Live Well, a show about doing small things to make big changes in your life. I'm Grant Stenzel. My goal is to help you regain hope and walk with you down the path of healing. Through my experience as a licensed clinical professional counselor and former pastor, I enjoy helping individuals and families navigate through mental health issues. On today's episode, we're going to talk about depression in children and how we, as parents, can provide support. It's so difficult to be the parent of a child who battles depression. On top of the pain associated with the knowledge that they're in pain, many parents also feel personal shame that their child isn't quote-unquote normal, or in some way that we've failed them. To cope with those feelings, parents sometimes minimize the mental illness, or they just try and look on the bright side. I urge you instead, acknowledge the depression. Talk openly with your child about it. The key is to give someone who's depressed small, measurable goals. Anything beyond that has the potential to completely shut them down. Here's a step-by-step path that you can take. 1. Know how depression manifests. Radical changes in behavior are fairly easy to spot for an observant parent. Perhaps your child is suddenly much more isolated, or they stop enjoying the things they used to love. But the one depression symptom that most people seem to not recognize is anger. Most kids and teenagers turn to anger when they're depressed. They don't know how to process what they're feeling, which is intensely frustrating, and therefore anger results. 2. Accept the diagnosis. Once you realize your child might be depressed, it's time to have them evaluated by a professional, and often to seek regular child therapy or teenage counseling. Make no mistake, it's really difficult to take this step. It's much easier to avoid and deny the problem, to spot a rare day and use that as proof professional help isn't necessary. This is shame and guilt getting in the way of what needs to happen. Don't let it. 3. Communicate. Try to position yourself as a safe haven for your child. Ask them to come to you with whatever's on their mind and let them know they'll be listened to without judgment. And then, this is the difficult part, actually listen without judgment. Thank your child for sharing themselves with you. That was a courageous step for them. 4. Find a counselor and begin talk therapy. It doesn't need to be at Stenzel Clinical, although you'll be welcomed with open arms if you do choose to come here. Child therapy, teen counseling, family counseling services are all crucial for the family that's battling depression. The important thing is to find the right office and the right therapist for your child. 5. Take care of yourself. Depression is a solitary disease, but the way it affects a home is anything but solitary. Every member of the family is impacted by a child's depression. Make sure you follow through on step 3 is much easier if you're well rested, relatively stress-free, and practicing self-care. Depression is a heartbreaking mess of contradictions. You don't want to die, but you don't want to live. You feel incredibly lonely, but you don't want to talk to anyone. You wake up in the morning and wait for night to come again. When a child is in the midst of these low points, they often think they'll feel this way forever. But if you follow these steps, hope, healing, and better days are ahead. That's going to do it for today's episode. Visit stenzelclinical.com/news for helpful tips on parenting, relationships, managing anxiety, battling depression, and more. You can also find us on social media with the handle @StenzelClinical. If you enjoyed our show, please be sure to leave a review. As always, thank you for listening.